Hi class, my name is Tiana Otsuka and today I'm going to be presenting on epilepsy. This is my outline. This kind of just goes over the different subjects that I'm going to be talking about. Okay, so etiology. So epilepsy stems from the central nervous system and it's classified as a neurological disorder that causes recurring seizures. The CDC says that to have epilepsy, you need to be having 2 or more seizures in a lifetime. There are many different causes for epilepsy, such as infection. There's the very common traumatic brain injury. Stroke is a very common one as well. And then there are deficiencies like GLUT1, which is a deficiency of your brain not getting enough glucose. There is the cortical dysplasia, and cortical dysplasia that happens before a child is born. And the developing brain cells are not going to the correct area, so they're not developing in the correct way, and this can cause epilepsy for a child. And then there's mesial temporal sclerosis, and this is in the temporal area in the hippocampus, on the hippocampus, and this is scarring of this area, and this can also cause epileptic attacks. There's different types of seizures. So there's tonic, atonic, colonic, myotonic, or myoclonic, and then tonic-clonic. Tonic seizures are just stiffening of muscles and joints. So you could see someone with like very stiff arms, or their legs will kind of seize up and be stiff, and they don't have a lot of control over them. The colonic is a seizure that involves like jerking and kind of like just seizing up. There jerking motions that can happen across both sides of the body as well. And then there's myoclonic, which is also jerking, twitching movements that occur in the upper part of the body and the lower part of the body, so the legs and the feet, or I mean, sorry, the legs and the arms. There's the atonic, and these seizures are more of a loss of muscle tone. So someone that's having this atonic seizure could simply slump over and kind of lean back. Just loss of muscle tone, maybe move their neck weird, like loose sensation of like being able to hold their neck up, and that could be a sign that they're having a seizure. There's also tonic-clonic, and these are also sometimes called grand mal seizures, and these are kind of the ones depicted in a lot of movies where you see someone on the floor seizing and jerking and twitching in a very violent way. There's also absent seizures, and these can be called petit mal seizures. And these are just simply seizures where someone is simply staring out to space. Another reaction is maybe rapid blinking of the eyes, but they kind of just look like they're staring out to space and daydreaming. This is just a picture showing kind of the different seizures. You can see the one on the left, her arms are stiff and rigid, and that's kind of more of a tonic seizure. And then the one of her on the floor, that's a tonic-clonic seizure, more of like the jerking motions and seizing of the entire body. And then the one where she's reading the paper and looking into space, that's going to be the petit mal seizure. You can see that she kind of just is looking blankly, not really doing much, and the seizure is kind of still just going throughout her brain. Okay, so demographics. It's estimated that 65 million people over in the world suffer from active epilepsy, and of those 65 million, about 3.4 of them are living in the United States currently. In addition, 1 in every 26 people will develop epilepsy at some point in their life. And epilepsy can kind of occur at any age. It obviously affects both genders equally, and it does not discriminate. It happens to people all around the world, so in almost any race, they have epilepsy. 20% of people with epilepsy get non-epileptic seizures, and these happen in the brain, and these are sometimes very hard to diagnose because even the EEGs that they take of the brain can look very normal. So these are very hard to kind of pinpoint and understand that, okay, this patient, this is what they're suffering from, is these non-epileptic seizures. Again, these can be just staring out into space. And then over 470,000 children suffer with epilepsy in the United States, which is quite a bit. Some more demographics. There's 15 to 19%. There are people that have epilepsy, and they're 15 to 19 times more likely to drown. And obviously, if you have friends, family members, you should always keep an eye on people that have epilepsy. If they're in any kind of body of water, this can happen very easily. And then 1 every 3 people with epilepsy suffer from depression and anxiety. And those can often come from not knowing how or why you got epilepsy, or possibly losing your autonomy because of epilepsy. I'll kind of briefly go over this one as well. 50,000 people are estimated to die from a seizure-related causes. That can be very scary. Obviously, people that have epilepsy shouldn't be driving because you can hurt yourself or you can hurt others. Obviously, swimming, again, is another thing that you have to be very careful doing when you have epilepsy. So there's a lot of day-to-day things that kind of hinder your ability to live that normal life when you have epilepsy. And then 2/3 of the patients that have or developed epilepsy have no idea why they got epilepsy, which can be extremely frustrating, again, leading to anxiety and depression for patients that suffer with this disease. So seizures occur in the brain, and they can occur in any area of the brain. Most commonly for children, it's the temporal and the frontal lobes that they experience their seizures. But they can propagate in one area, or they can start in one area and propagate until the other area of the brain. They can move throughout the entire brain all at the same time, or they can just be very specific focal regions of the brain. And then these focal seizures appear. So focal seizures, they can happen without a loss of consciousness, and then they can happen with impaired awareness. Again, I'll show you the next slide. This is showing a grand mal seizure, the red brain, where you can see it's kind of propagated through the entire brain. And then the green one shows that this is a focal seizure. This is focused really on where the red area of the brain is. This is another brain scan showing how these seizures can be focal and just be very specific to one area. And this is really important for surgeons who are going in looking to remove parts of the brain to help them with their epilepsy. So physiology and symptoms. Symptoms can vary. Again, they can just be staring blankly out to space, or they can be severe jerking motions, or jerking and seizing of the muscles, stiffening. Twitching movements can also be symptoms, and then loss of muscle tone and definition. And this can happen. And when this happens, the patients are a lot more likely to fall and hurt themselves, and especially if they lose consciousness of themselves and their surroundings. Temporary confusion is very common, or loss of complete consciousness. So they'll wake up and be like, what happened? Again, anxiety, fear, deja vu, feeling like you're in a dream that you've been here before. These are all very common symptoms as well. And then there are these seizures that are like earthquakes. They have these big seizures, and then there's small aftershock seizures that follow afterwards. These are just symptoms. Obviously, you can see the weakness of the muscle, contractions and jerkings of muscles, confused speech as well. Okay, diagnosis and treatment. So epileptic medication, it's very broad, and there's quite a bit. So there's 20 different types available today, or over 20 different types of medications available today for patients that suffer with epilepsy. and 70% of them will respond very well. In rare cases, there are surgery where the surgeon can remove a specific part of the brain, like what you're talking about earlier. And there is thought that a ketogenic diet has been shown to help some individuals with epilepsy. So a high fat, low carb, and low sugar diet would benefit patients with epilepsy. And then there's some really cool AI. So there's a vagus nerve implantation device, which delivers electrical impulses to help reduce the amount of seizures an individual is having. So the larger part on the picture is placed inside the chest cavity, and then this wire is strung up and it goes into the brain. And that kind of helps in just regular pulses of energy constantly through the brain. There's also a cannabis-derived drug, Epidiolex, and that has been FDA approved for children. So this is a natural drug that is found in nature, and it's concentrated and it's given orally to children. Unfortunately, there are no cures for epilepsy yet. There's still a lot of research that's being done for people that have epilepsy, but in many cases, people can live a very happy and normal life, thankfully through medication and therapies. This is just another technology kind of showing how we can see specific focal seizures, and this is really important for surgeons when they're planning their surgeries for their patients. And these are my references. All right. Thank you so much.